If you're referring to ball or foot pain, which we can see in this area marked with this arrow in the redness area, commonly what you get is a person comes to you as a patient saying, I complain of a hot area underneath the ball of my foot, or even a high area of weight. The other thing people have is a callus and a buildup of tissue there, and sometimes they come to a practitioner to have it removed, but it obviously comes back again. So if we have a look at the human foot, the thing that we notice in the same region is we have this area of pain underneath the metatarsal heads, but the longest bone is the second metatarsal. Now what happens when we suffer from excess pronation, and we relate that back to nature versus civilization concept, the metatarsal area becomes hypermobile, and we get a collapsing of the mid-tarsal arch area as well as the metatarsals. And when you get that occurring, the second metatarsal becomes very loaded underneath the plantar surface. You get simply an increase of pressure, you get inflammation, and as a compensatory measure, callus builds up to preserve the soft tissue. And the problem is, you're not treating the cause, you're treating the symptom.
So this condition is commonly called metatarsalgia, and it occurs also a lot in women who wear high heel shoes, is that right?
True.
Is that the same thing?
Exactly. A person who has metatarsalgia can get it by walking on flat ground, but obviously if you're going to load the front of your foot when you go up on a high heel, you're going to get more pressure. So generally women will suffer from metatarsalgia more than men due to the fact that they wear higher shoes, but the same instance, once you've got this biomechanical problem of excess pronation and you come to flat ground, you're still going to have the same problem. So that's why I would advocate orthotics in that particular case.
So it's essentially friction and pressure caused by poor alignment.
Exactly. It's a plantar flexion, a splaying, hypermobility of the forefoot. The second metatarsal is the longest, and when all the weight of your body goes on it, you get inflammation, weight, and as a compensation, callus buildup.
And what about corns and calluses? How does excess pronation contribute to corns and calluses on the foot?
Okay, that's a good question too. Corns and calluses, a lot of people think, well, my shoes are tight and therefore rubbing and I get corns and calluses. Now, most intelligent people shouldn't be buying tight shoes, and there are many people who have perfectly good shoes and still get corns and calluses. What happens is when the metatarsals become hypermobile due to the excess pronation, the forefoot splays and plantar flexes. And what happens, as a compensation, the digits start to come up and then they curl at the tip, which is kind of like the same effect as a scoliosis in the back, but we're getting this curvature in the foot. And when these toes become clawed, as one would say, you get friction on the tops of the toes, on the base of the toes, and again you get callus as a compensation.
Now, another common site for callus build-up on the foot I've noticed and we've discussed is this medial side of the big toe, the fat pad, and the heel.
Exactly. I think I'll just explain how that occurs. Again, it's excess pronation due to the hard, flat ground that we walk on. But if we imagine that this is a heel, and this is an arch, and this is a foot, when the ground is hard and flat, it causes our foot to pronate, and if you rotate the foot in, you get a lot of pressure on the inside area of the big toe. Pressure means callus. Callus can give you pain, and this whole cycle of abnormal forces on one area causes the problem. And again, the use of an orthotic to realign the foot takes the pressure off that area, and more importantly, distributes the weight equally across the 5 metatarsal heads. There's a common misdiagnosis between metatarsalgia and the condition we call Morton's neuroma, or I like to call it Morton's neuritis. As we see in this area here, it occurs basically in the same region as metatarsalgia, so a lot of people think that it's the same diagnosis. But what happens generally, if we look at a foot, we have a lot of nerves run into the foot, but at the base of the foot we have a medial plantar branch, a lateral plantar branch, and there is a conjunction between the third and the fourth in the plantar area, which is in this area, but at the base. Now when you pronate excessively and your forefoot becomes hypermobile, you get the metatarsals splaying and moving a lot in the transverse plane, which is this plane here. Now this nerve tends to become impinged or pinched, and over time it becomes larger, and there's a fibrous tissue builds up around this nerve. Then you get this enlargement, and one of the tests can feel this. The pain can feel the same, but generally people sort of say, I feel like a nerve sensation or an electrical shock running down my toe. Okay. A lot of times they can't figure out whether it's a third or the fourth, but generally you'll find in many patients they may exhibit a numbness in the toe, generally the fourth. But one way to test it is a very old technique, but very effective, is the crunch test. If there's an enlargement of the nerve here, and I simply get my hand and I squeeze the bones together, the patient will jump through the roof because it's impinging that nerve. Okay. And normally they'll also feel the numbness. Sometimes I've even seen the fourth toe blue. It's affected the circulation, and overall the treatment's the same. We use a metatarsal raise in the forefoot to give integrity to the forefoot, but more importantly we come back to the rear foot with an orthotic to control the mid-tarsal joint and the rear foot, because the whole foot works as one. So controlling one bone is not as effective as controlling the whole of the foot.
Okay, great, thanks.
Commonly when people suffer from ball of foot pain, they get an increased pressure, and also you can see here a build-up of callus in this particular area. And what happens is these bones tend to sort of drop in a downward position this way, and you can see the toes come up here, and then the tips of the toes come down this opposite direction. So what we find is that with a correction using an orthotic with a lift in the metatarsal area, we raise this area here, we take the pressure off the front of the foot, at the same time the toes become straighter. So when you drop the foot, the pressure builds up callus, the callus causes pain, and at the same time you develop this curling of the toes, which causes corns on the tips of the toes. So again, if we push up underneath this area, we reduce pressure on the forefoot, and again the toes are straight, they don't rub on the shoes, and no rubbing, you get no friction, you get no callus or corns.